So hello, my name is David Tamborero. I'm a postdoctoral researcher in the Institute of Molecular Medicine in Helsinki, Finland. I'm here in ASH meeting presenting the results of work entitled Landscape of Driver Lesions in Multiple Myeloma and Consequences for Targeted Therapies. So in this work, the question we want to answer is which are the alterations that drive the relapse in myeloma, and whether these alterations can be linked with possible benefits in targeted therapeutic agents. For this study, we prospectively included 40 patients from the University of Helsinki Hospital, divided between newly diagnosed myeloma patients and refractory relapse patients to the conventional therapy. So for each of these patients, what we did is to perform molecular profiling on one side, and in the other side, what we do is what we call the ex vivo drug screening. That is to check ex vivo the sensitivity of each of these patients to a panel of more than 300 drugs, both investigational or already approved anti-cancer agents. So as a result, so far, as expected, we found that the genomic landscape of myeloma is quite heterogeneous. Interestingly, if we compare the relapse patients with the diagnosed patients, we found that relapse has clearly larger amount of driver mutation, but the copy number alterations are quite similar between both groups. So what we found basically is that there is mutations in genes that are shared between both groups. So for instance, RAS mutations, that as you know, it's the most prevalent gene targeted by myeloma. We have mutations in both relapse and diagnosed patients, but between the relapsed patients, they tend to have a larger clonal frequency of these mutations. This points out that probably these RAS mutations are positively selected during disease progression. On the other hand, we found that there are mutations in particular genes that appear only among relapsed patients, and actually they tend to be in lower in subclonal proportions. So this really stresses that these mutations appear in later stages of the disease. We also found that among relapsed patients, they have particular mutations in genes that appear only among relapsed patients, and moreover, these mutations appear in subclonal proportions. So this really stresses that this mechanism appear in later stages of the disease. These genes are mainly related with p53 pathway, P3K/mTOR pathway, and also in biological processes that are maybe less well demonstrated to be involved in myeloma, as for instance splicing factors and chromatin remodeling epigenetic modifiers genes. This is from the genomic point of view. From the drug screening, drug sensitivity point of view, what we observe is that myeloma patients basically show 4 different patterns of response, ranged from sensitive patients to highly resistant patients. And interestingly, most of the patients in the sensitive group are relapsed patients. And these samples are exhibiting a very good and selective response to several signal transducer inhibitors, like MEK inhibitors, P3K/mTOR dual inhibitors, rapalogs, and also very good response to epigenetic chromatin modifiers, as for instance HDAC inhibitors. So taken together, this data suggests that myeloma relapse is mainly driven by mutations, at least from the genomic point of view. These mutations hits additional biological processes. The architecture of the clones in relapsed patients is more complex, as expected, so it's more difficult to deal with. That's why they relapse, of course. But the good news is that they seem that these additional alterations confer a very good response to targeted drugs. So right now our feeling is that this subset of patients that actually they have fewer options from the conventional treatment, they are very good and very attractive subset of patients to try with these novel therapeutical approaches. As next steps, of course, what we have to do is to see if this ex vivo data is correlating with in vivo data, and eventually if we can demonstrate clinical benefit for these findings.